Some health experts say the triple threat of RSV, the flu, and COVID-19 may be less severe for children this year compared to what we saw last fall and winter. We're joined by Dr. Jesse Papenburg to discuss this. Thank you for your time.
My pleasure.
So about a year ago, pediatric hospitals were really full of children battling these respiratory viruses. What changed this year to make it more of a, quote, regular season?
What had happened was that during the first year of the COVID-19 pandemic, with all the restrictions that were put into place and the near absence of RSV and influenza, there were more people in the population that were susceptible to get infected when the viruses did return. And when they did return last year, lots of people across the age spectrum got infected, but it's really our young children that are most vulnerable to running into complications and requiring hospitalization either due to RSV or influenza. Hopefully now, things have kind of balanced out. And with more of the population having had a recent exposure to these respiratory viruses, we're hoping to see a more typical season in terms of the timing and also in terms of the number of hospitalizations and emergency department visits.
Now, it is important to point out that, the flu, COVID-19, particularly RSV, do pose some risks to children. Can you speak about that?
Absolutely. RSV is actually the leading cause of hospitalization in children under 1 year of age in Canada. And we know that influenza is also an important cause of hospitalization, again, especially in our youngest children. But that risk can maintain throughout the life cycle, especially in persons with underlying medical conditions that can put them at higher risk for complicated influenza infection. So yes, year in, year out, in the wintertime, we're faced with a lot of severe cases of RSV and influenza in children's hospitals.
So what can parents do to help protect their children as we are approaching that colder season?
Well, we know from the COVID-19 pandemic that there are things that families can do to reduce the risk of a respiratory viral infection in their household. In particular, if you have a young child under 6 months of age, or especially under 3 months of age, you want to avoid having them come into contact with somebody who's sick. If there is already somebody who's sick in the household, we know that wearing a mask while you're taking care of that young baby can also help reduce the risk of transmission, as does frequent hand washing. So these are some of the basic things we can do. And then on top of that, children as of 6 months of age are eligible to get their first flu vaccine. And this year, the flu vaccine is free for all residents of Quebec. And I encourage families with young children, especially those under 2 years of age, to get themselves vaccinated and to vaccinate their children against influenza. And finally, COVID-19 vaccination is also available for children as of 6 months of age. And I think, though, that's more of a family level decision in terms of the risk that COVID-19 poses to kids, which we know is small and still not zero. And unfortunately, we don't know which children are going to wind up having a complicated COVID-19 infection or maybe even developing long COVID types of symptoms. So I think families who are interested in that should speak to a trusted healthcare professional or get information on the web from trusted websites.
Okay. Thank you so much for your time today.
You're very welcome.